The House of Representatives has assured relevant stakeholders in the healthcare sector of the country's willingness to amend the Federal Medical Centers Act 2002 and to give accelerated passage to the 16 bills seeking to establish new federal tertiary health institutions across the Federation. Speaker of the House, Tajuddin Abbas, gave the assurance in Abuja at a public hearing on 16 bills aimed at establishing one health institution or the other in each state of the Federation, organized by the House Committee on Health Institutions. Chairman of the House Committee on Health Institutions, Amos Megaji, expressed concern that migration of health workers from Nigeria to other countries in search of greener pasture poses significant challenges to the nation's healthcare system.
Government must pay serious attention to the concept of PPP in running public health service facilities as a way of improving funding and quality of care. Federal tertiary institutions shall be encouraged to, within the prescription of relevant extant law, operate PPP in provision of healthcare services and programs.
The establishment of the college will further boost economic activities of the area where it is sited. The migration of health workers and the epidemics and their emerging trend underscore the need for Nigeria to have enough and an efficient health workforce that will be readily available when there are any health emergencies.
More recently, there has been an enormous migration of doctors, nurses, and other health workers in search of greener pasture in other countries, leaving Nigeria health sector severely understaffed. The need to reposition the healthcare sector to meet numerous emerging challenges is critical to its improvement.
Minister of Health Professor Ali Pate, who also attended the hearing, said the ministry has no objection to the proposed establishment if they are based on merit. On his part, the president of the Nigeria Medical Association, Bala Mohammed, who was represented by Benjamin Oluwatosin, while commending the sponsors of the bill for their foresight, made suggestions on the best way to strengthen existing health facilities in accordance with global best practices.
The establishment of this medical center is long overdue in Jigawa State. With a population of over 5 million people, lack of federal medical center forcing residents to travel long distance for quality health, this amendment will address the healthcare disparities in the region.
The present 10th House of Representatives at its inception in 2023 set out for itself a legislative agenda whose implementation would surely bring about tremendous improvement in the living standard of our citizenry.
And if you closely look at those admission requests, over 8,500, they have a JAMB requirement at that time of 205 O-level credits. But we can take only 150. Where are we going to leave those young Nigerians that have JAMB of 200 and O-level results of physics, chemistry, biology, English, maths? Are we throwing them on the streets?